In 2023, global funding for HIV saw a decrease with total resources amounting to $19.8 billion US, marking a 5% drop from the previous year. This shortfall of $9.5 billion from the required $29.3 billion US by 2025 is hindering progress and contributing to increasing epidemics in certain regions. Domestic funding in low and middle income countries, which constitute 59% of the total resources for HIV, has declined due to constraints posed by the debt crisis, experiencing a 6% decrease from 2022 to 2023, marking the fourth consecutive year of decline. These financial challenges are impeding efforts to combat HIV/AIDS globally. Economic challenges posed by high debt burdens in African countries such as Angola, Rwanda, Kenya, Zambia, Malawi, and Uganda, where interest payments exceed 50% of government revenue, have been recorded. Many countries in sub-Saharan Africa face severe debt distress, spending significantly more on servicing debt interest than on health care. UNAIDS Executive Director Winnie Byanyima also emphasized the need to tackle stigma against marginalized communities in Africa. These include sex workers, men who have sex with men, and drug users. Currently, these groups account for 55% of new global HIV infections, up to 45% in 2010. Nearly a quarter of the 40 million people living with HIV have not yet accessed life-saving treatment. Friedel Dausep, who identifies as gay, contracted HIV in 1995 and became an activist.
I plan to become an activist, but life experiences shape the decisions to help remove a law that remains one of the biggest impediments to ending HIV among the most marginalized communities in Namibia, and to help protect myself and others from harm. The existence of this law emboldened homophobes, bigots, to act with impunity and to violently exclude LGBTIQ+ people from peaceful coexistence. Our government itself made decisions that hurt public health, like refusing to distribute condoms in prisons because of this harmful and hateful law.
Achieving the goal of ending AIDS by 2030 will require addressing these economic challenges alongside improving healthcare access and respecting human rights.
To save lives, governments must decriminalize same-sex relations, must decriminalize sex work, must not use a punitive approach, a criminal approach to drug control. They must end the discrimination faced by girls and women that's driving the HIV/AIDS pandemic, especially in Africa.
Byanyima, who stressed the urgency of actions, highlighted that decisions taken by leaders this year will determine if global targets will be met, AIDS is ended as a public health threat by 2030, and a sustainable HIV response is built.